Well, hello, doctor. Today I want us to review a very important topic on headache, but we're not going to focus on headache. We're going to look at another objective under the MCCQE1 objective headache, and it's going to focus on something very important you need to know. So let's dive in. Let me share the slide and let's dive in. So the objective for headache is 39, but I want us to focus on lumbar puncture. And as usual, I'll encourage you, I need your full attention. This video is going to be short, straightforward to the point. So just give me your full attention. You can play it over and over and over again. Put off everything, like YouTube, your phone, just put it off and just give me your full attention. I hope I have your full attention now. So now let's get into it. So the objective 2B under 39 talks about indications and contraindications for lumbar puncture. Indications and contraindications for lumbar puncture. And this is something you need to really know. Like if they are putting emphasis on it, you've got to know it, you've got to cram it, you've got to get it into the mind, okay? So lumbar puncture, what are the indications? There are diagnostic indications and there are therapeutic indications. So diagnostic and therapeutic. Now, with the diagnostic indications, we have, if you want to find out if somebody has a CNS infection, so like meningitis, encephalitis, you do a lumbar puncture to find out, right? And with meningitis and encephalitis, we even have bacterial meningitis, we have viral causes, we have, fungal causes, we have even TB. And with that, you'll also have to know all the various characteristics. We will deal with that in another video. As well as if you want to find out, if the patient has some inflammatory condition like multiple sclerosis, GBS, vasculitis, you can also do a lumbar puncture as well, especially if it has affected, the central nervous system. And if the patient has, subarachnoid hemorrhage, you want to do a lumbar puncture, especially if the CT scan is negative. And there are subarachnoid hemorrhage findings on lumbar puncture, for example, blood in the tube, xanthochromia, but I don't want to get into that. For now, I want us to look at the indications in broad terms. And if the patient has, something like a CNS neoplasm as well. Now, there are also therapeutic uses of lumbar puncture. So if you want to administer anesthesia, so for example, if a patient needs to have a cesarean section or any surgical procedure, which will need to make sure that the lower limbs are, paralyzed periodic for a short period for this surgery to be done. You can use, you can do lumbar puncture. It can also be used to administer chemotherapy and can also be used to administer contrast media. So these are the indications, diagnostic, therapeutic, okay? Now, the contraindications, very important. Please don't miss this. Learn this inside out, know it. If you're waking up from sleep, you should be able to tell. So if the patient has raised intracranial pressure, and you can look at it from the side of the Cushing's triad, and if the patient has infection over the lumbar puncture site, as well as suspected epidural abscess as well, you don't want to do a lumbar puncture. It is contraindicated. If the patient has some thrombocytopenia, so let's say the platelet level is less than 50 times 10 to the next 9, or if the patient is ongoing anticoagulation as well. For example, some textbooks will say, if the INR is more than 1.5, you want to be careful. And if the patient has a coagulopathy, why? Because the patient can develop a hematoma, and that can lead to, a very bad caudal equina syndrome. And if the patient is uncooperative, that's also a contraindication, as well as, if the patient has, an acute confirmed spinal trauma or congenital spinal abnormalities, which will not allow you to, pass your lumbar needle easily. These are contraindications. So this is a quick review of this. As usual, good luck on your exam. Keep a positive mind, positive vibes only, keep a positive life, and then believe that you're going out there to ace this exam. All the best, and let's meet, in the next video to share knowledge for the QE1 exam.